ADHD stands for Attention Deficit Hyperactivity Disorder. It is actually quite a common brain condition and affects up to 5% of children and 2 to 3% of adults. Right? So in up to 50% of children with ADHD, the symptoms do persist to adulthood. ADHD as a brain condition is very interesting. Right? Basically, it means that the brain is fundamentally quite different from the average person's. Right? The ADHD brain is driven by novelty, challenges, urgency, right, and variety and interest, rather than the importance and priority of the task at hand. As you can imagine, this will lead to many problems in school, in workplace, and in social relationships, right? It's unfortunate because it's not really a disease per se, right? But because society and companies and workplaces organize their processes around the average non-ADHD brain. And this is why ADHD sufferers tend to struggle, right, in their life. Okay, so what to do when you are diagnosed with ADHD? There are perhaps 5 main takeaway points. Firstly, perhaps you can use some lifestyle strategies to manage the symptoms of ADHD. Right? I like to tell my patients to remember 4 things. Right? To prioritize, to organize, right? To simplify, and to declutter. Right? And to apply these 4 principles in all aspects of their life. Right? These may include the physical spaces that they work and live in, their homes and their offices. For example, to declutter and to organize their spaces. This may also include digital spaces that they are working on, like their emails and the digital files, for example. Importantly, this will include their mental processes, right, and the mental space, right. So this includes the to-do list, right, the number of projects and ideas they want to work on at any one time. Perhaps limiting them to just 2 or 3 projects or ideas they want to follow through at any one time to avoid being distracted and then not following through with any of the projects. This also applies to their social relationships, limiting the number of social engagements they have per week and kind of like simplifying, organizing, and decluttering their social life as well. Often when people get diagnosed with ADHD, they feel relieved and vindicated, right? Because they finally realize that it's actually not due to laziness, right, or a lack of discipline or willpower, that they have been brought up to feel or believe so, right? And that ADHD is a real brain condition that is a result of differences in chemical makeup and the wiring of the brain. And if their family and friends can understand that part of them, I think it will help a lot, right? You can even consider letting your bosses and your colleagues know about your ADHD. If you are diagnosed to have ADHD, or you suspect that you have ADHD, right, or you are considering the use of medications for your ADHD, feel free to book an appointment with a psychiatrist or a therapist and discuss some of these issues with them.